Seizures and Epilepsy. Introduction. Seizure is the term used to describe a change in how you think, move, or feel caused by abnormal electrical activity in the brain. Select true or false. Correct. The term epilepsy is used to describe a condition where someone has only one seizure. Select true or false. Correct. All causes of seizures and epilepsy are well understood. Select true or false. Correct. Even though we know much more about seizures and epilepsy than we did 50 years ago, scientists still don't know the cause of a lot of them. All seizure-like behaviors are caused by epilepsy. Select true or false. Correct. Some seizure-like behaviors are not caused by epilepsy. Seizures that limit themselves to one part of the brain are called focal seizures. Select true or false. Correct. An EEG is a test that can always tell if a person has abnormal activity connected to epilepsy. Select true or false. Correct. EEG cannot measure waves from deep inside the brain. In addition, some people show normal brain waves but still have epilepsy and seizures. Some patients may have to take epilepsy medication for the rest of their life. Select true or false. Correct. Only a doctor should determine if and when you should stop using anti-seizure drugs. Most people with epilepsy are good candidates for surgical treatment. Select true or false. Correct. Some people with specific types of epilepsy may benefit from surgery. An evaluation for surgery is usually recommended if 2 or 3 different drugs have been tried and have failed. Most people with epilepsy have normal intelligence. Select true or false. Correct. Most people with epilepsy have normal intelligence, and some of them are geniuses, such as Tchaikovsky, Nobel, and Napoleon. By law, people with epilepsy in the United States cannot be denied employment or access to any education or recreational activities because of their seizures. Select true or false. Correct. Most seizures end on their own and are not emergencies. Select true or false. Correct. Thank you for using Explain.